Hello all and welcome back to Mindful Mastery Live with me, Dr. Fielding. I'm so glad you made some time to join us today, and I'm super excited. I have a bunch of announcements today, it seems like. First and foremost, I'm thrilled to tell you that I've got Dr. Tonya Wood, who is my personal superhero, and she's going to talk to us about fertility frustrations in the age of COVID and what she's been hearing and seeing, and give you guys some suggestions and tips for how to get through this stressful period and make the most of it. But then I've got some side announcements that I just got to tell you about. I'm thrilled to tell you the book is out on audio. So please go buy it for your friends, family members, kids, everybody you know who's struggling with the stress of uncertainty in this lifetime transition for all of us. Also, there's a new Skill Weekly up, and I hope you'll sign up for the Skill Weekly blog at mindfulmastery.com, where I share tips and tricks every couple of weeks. So hope you'll do that. Now, with no further ado, let's bring on Dr. Wood. Here she is. Hi, Tonya.
Hello.
Thank you for joining.
Thank you so much for having me.
As you know, you are my superhero, and I sing your praises all the time. And I'm thrilled that you can come here. It seems like I asked you right when there was a National Fertility Awareness Week or something. Do I have that right?
Yeah. Yes, you're absolutely correct. Last week was the National Infertility Awareness Week. It's co-sponsored by Resolve, which is an advocacy group, a national advocacy group focusing on infertility, and the American Society for Reproductive Medicine, which is a professional organization of healthcare providers in the reproductive field. So,
nice.
Yes.
What is their aim? What is the aim of that group?
Well, there's two. So the Resolve is is much more an advocacy group. So they are available for consumers, clients to provide information, resources, tools regarding infertility treatment.
Mm-hmm.
They do a lot of advocacy work in Washington, D.C. in terms of insurance and advances in treatments, etc.
Okay.
So that definitely, yeah. So Resolve is definitely like the sort of the resource to go to for individuals and families and couples struggling with infertility.
Good for people.
And then the other, they're great. They're a great resource. You can find providers, you can find psychologists, counselors who specialize in this field. They have lots of information, and it's, I think, free to be a member for any individual.
So tell us a little bit about your background and training and all your wonderful community work, and then we'll get to the
things I do.
stuff.
Okay, I'll keep it brief. I promise. Oh, goodness. So I'm a psychologist. I have a small private practice in the LA area, which in the most recent 5 or 6 years, I focused primarily on infertility, pregnancy loss, family planning. Prior to that, I worked mostly actually with children and adolescents, and I was a school psychologist for many years. So most of my work as a psychologist was in community mental health settings, community-based settings. So schools, I even did a stint at a prison once as the therapist, not as I've enjoyed working in those settings. So I've done a lot of sort of community-based work, and then also became the director of clinical training at Pepperdine University in 2015, of which you're an alma mater, I know.
And also, I'll just share with everyone that I know Tonya and I idolize Tonya because she was my supervisor at the Women's Reintegration Center in Augustus Hawkins when I was doing my pre-doc and internship work, and that's where Tonya has done some amazing work. And now she's growing and becoming more and more influential.
I actually forgot about the piece. Yes, I was a supervisor, training director, and then a director of clinical training at Pepperdine, which is where I'm now. I'm on faculty at Pepperdine University, as well as the current president of the California Psychological Association.
So a lot of hats and a mom.
Yes. Which gets to how I came into specializing specifically in infertility.
Right.
It's, not uncommon for many of us on this journey is by my own experience. So in my own life, dealing with miscarriage and pregnancy loss and difficulty conceiving, I, at that time, sought out my own support system and looking for a therapist. And was really surprised as a psychologist myself of the lack of The lack of clinicians who were as well informed on the topic,
Interesting. Yeah.
who knew about that. And when I say informed, I mean on like the medical procedures aspect of it.
Well,
Because what I learned, what I experienced, I should say, as a person seeking my own support was that I had to spend a lot of time educating my provider on like what the infertility process was.
Right. How annoying. What other frustrations do your clients express when they come in?
Yeah, and that's another great question. I think in terms of interfacing with medical field and maybe healthcare providers, I see a lot of cultural sensitivity, and I think that's in part because as a African American therapist and appealing to a predominantly large like African American client base, that they seek out someone who kind of looks like them, who maybe also had those same kind of experiences. Especially on a topic like infertility, where people are considering donors and surrogates and the kinds of information that they're receiving and the kind of comments that are made that are culturally insensitive. So I think some of the frustrations that I hear quite a bit are about some of the, lack of attention to the cultural nuances in this area.
So I'm thinking about what we know from the research and reports of African Americans not being taken seriously by doctors in terms of pain and things like that. And I wonder if some of that bleeds into fertility and infertility distress, if the concerns are minimized and things like that. Is that happening?
Absolutely. I mean, I can speak from my own personal experience, but I definitely see that in the clients that I work with. I in my own journey, I fired a couple of different, OBGYNs,
Good for you.
because I felt like, they were like, oh, calm down, take it easy. And those are
the proverbial calm down. Yeah.
Yeah. And whether or not that was sort of culturally oriented, I don't know, but it does speak to that, like, sort of being heard and being taken seriously in terms of the nature of concerns. And so yeah, I definitely, experienced it myself and hear my clients having that same frustration.
So do you have some recommendations for people who are feeling frustrated but do you make some specific recommendations?
The short answer is yes. You are your best advocate and you know yourself well. I think especially in something like infertility, which can feel so unfamiliar and unknown and unexpected. And so you're kind of waiting for the doctor to tell you and give you the answers, right?
Yeah.
Which they may not always have. So I think I encourage the clients that I work with to don't worry about speaking up and asking questions. Get comfortable with asking questions. That's okay.
Yeah.
Become a consumer of the information. Like, don't overwhelm yourself with it, but become a consumer. Yeah. So that you yourself know, like, what the research says and what the sort of emerging treatments are, et cetera. And again, and to find their voice. I think it sometimes goes hand in hand with the emotional piece, especially for the women I've worked with, because going through this process can feel like an attack on their identity as a woman, right? And especially if they are driven and accomplished and, they've been able to set and achieve all the goals they've always wanted, but then they encounter this. And in those moments, you kind of have lots of doubts and insecurities. And so I try to encourage and remind them of what they have been able to do in the past and to take some of that and bring it to them with them to this process also.
But it also reminds me of my own personal experience, right? When I was, my fertility years kind of went bye-bye during school because I was a returning student. And when I started talking to my OBGYN about, wanting to look into fertility, I just got told, it's not going to happen for you. No sensitivity whatsoever about, I hope this is getting better. There's a bridge statement or they need to learn the validation skill. I understand it's hard, not just here's the bad news.
Yeah, and what you're saying is probably another piece of advice that I give clients is no one works for you, right? I mean, doctors, professionals, we're all human too, and we have our strengths and weaknesses. We have our characteristics, our traits, our temperaments, and so I'm not wanting to come across as too harsh or critical of my medical colleagues, but often they're just very direct and specific, and they
different training,
right? It's a very different kind of training. They're just giving you information and facts, and it's not coded in any kind of like sympathy or understanding of like, this is emotional information that I'm having to digest in this moment,
Yeah.
And for some individuals, that's okay. They don't want their doctor to be emotional, but for some, they want a little bit of sort of sensitivity, understanding to come through.
I would think though, yeah. So yes, you want your doctor, your surgeon to be like, I want a robot. Give me the robot. And yet fertility is a special case, right? Because in many cases, I'm assuming this woman has been shot up with hormones. Right?
Yes.
And so,
At some point, yes.
So sensitivity training, Tonya, I think this is a niche here for us. We need to get in there and start training some OBGYNs on the validation skill.
Yes.
Which is, acknowledging that someone's uncomfortable and feeling a different experience than you are, and, that sugarcoating before giving them the difficult message.
Exactly.
Yeah. Interesting. So now during COVID, right, I thought this conversation would be so important because that's one of the first interesting things that popped into my mind. What if you were just mid getting your shots, you were just planning out, you're in your mid to late 30s or even 40s, and the clock is clanging, and now they're like, just stay home. What are you seeing? What is your advice for people?
Yeah, so I'll tell you sort of what I've seen, what I've heard, and then can lead to the advice. But please jump in with questions in the middle of all that. And you're absolutely right. That is exactly what happened as the world and our country and our states and cities went into shutdown and made different decisions. Also in the medical field, right, about what medical procedures or surgeries, et cetera, would take priority. And so I think it was maybe late March or early April, the organization I mentioned before, the American Society for Reproductive Medicine, they developed a task force. And so they issued out guidelines for everyone in this field. Okay. And essentially it was, if you are in the middle of a treatment, in the middle of a cycle, you can and you should continue. But if a treatment has not started, that they would be put on hold. And that was not to suggest that, I know, right? That wasn't to suggest that infertility treatments were not considered an essential medical treatment, but it was to recognize that, despite our emotional attachment to that time frame, which there is, and I can speak to that, because there's a biological clock.
Yeah, I can speak to it too.
So we're
came and went
to that clock, right?
Yeah.
That if delaying treatment would not have a negative possibly a negative outcome medically, if it wouldn't adversely affect someone's mental health. And also because there's this, concern about resource allocation, right? That depending on the number of doctor's visits that would be required and the possible exposure to other patients or to healthcare providers and the need for surgical masks and surgical gowns and PPE, that they felt it was most responsible to say, we will not begin any new treatments right now. Yeah. As of Friday, the 24th of April, they actually updated their recommendations. And they haven't shifted from that really. What they've said, though, is that, their national and local jurisdictions have different guidelines now that they're abiding by. And they just kind of gave some parameters for physicians, doctors, including psychologists such as myself, of kind of how to begin to open up, slowly. So
in different states and different districts, people would sort of just have to check with their individual guidelines.
Exactly.
Okay.
For anyone who is joining us and who is less familiar with the infertility process, let me give some background as to why that time frame would feel so critical. Because first of all, it comes after you can't even receive a diagnosis of sort of quote unquote infertility. The medical definition is for a woman under age 35, I think it is, under age 30, there's an age difference. Under age 35, it's a year, it's 12 months of unprotected sex that does not result in a pregnancy.
Okay.
Over 35 is 6 months of unprotected sex.
Okay.
So already, even before you can kind of get the definition, you've been on a time frame, right?
Yeah.
And then there's this host of tests. And these tests are usually organized around the woman's biological system. And so this is the menstrual cycle.
Sure.
Right. So
Mm-hmm.
there's certain times and points in the month where we do certain tests to look at like egg reserve and ovarian functioning, and those can only be done like once a month at a certain time. So your everything up to this point has been determined by this clock. And you're like waiting for that next month to start. So you've saved up money, you've checked your insurance to see what's covered, you've gone through rounds of tests, and you're like, okay, yay, next week I'm finally going to, and
I can't even imagine.
And
as I'm hearing, I actually always joke that I'd like to make T-shirts that says "Biology doesn't lie," right? Like, or your biology doesn't care, right? How hard you're trying, and it's so especially in recent decades, right? We like to think, well, that rule doesn't apply to me, or I'm trying, or I'm doing this. Your biology is your biology, and your biology is, doesn't care how great you look, how much Botox you've been doing, and there was certainly a rude awakening for me. Like, well, what do you mean? I look and feel great. Why? And that's when my OBGYN is like, it ain't going to happen for you, honey. So with all of having jumped through all those hoops already, having like, having been so disciplined really, and then to get like this tsunami of, just devastating for a lot of people, I'm sure.
Yeah.
How do you help people walk through that? I mean, I was saying on another chat the other day that there are times when when you can prevent a problem, and there's times when you can solve a problem. And then there's times when your skillfulness means your ability to tolerate it, right? It's distress tolerance, it's willingness. So how do you walk people through that challenging process?
Mm-hmm. And it's actually probably not that unlike the process, even when there's no pandemic going on, in a sense, because already for many individuals suffering with infertility, they feel like a lot of this is out of their control, and they haven't been able to kind of influence the outcome in the way they want. Like you said, your body doesn't care. Listening, you're like, what
doesn't care how hard you're trying.
So in some ways, they already arrive to my office having that experience. And now this adds another layer that is completely out of everybody's control. And so usually what I do, regardless of pandemic or no pandemic, is try to have clients focus on their values as opposed to the goals. So, and as you're aware, Laura, I incorporate a lot of acceptance and commitment therapy into my work with clients. And so one aspect of that is sort of committing to values driven behaviors. And so, it's tough having, especially infertility clients, think about values versus goals, because they're focused on the goal, which is to get pregnant. And I, kind of walk them through that dance of.
I think we need to clarify values versus goals for people listening also, right? So values are your big why, right? I call them your true north. So the value of having a baby might be family, might be connection, might be a legacy. It might be a lot of reasons. But it's not the same, right? The goal is the outcome. The value is the why. Mm-hmm. And so for people who are watching or listening or thinking in their own lives, it's a very good exercise to think about why. What does that child represent for you? When I was thinking about it, I wanted family because I came from kind of, I don't want to put a judgment on it. Let's just say a family with not so many psychological resources, and addiction and domestic violence, all kinds of goodies. And so I really wanted to have my white picket fence and my happy, nice, and I also didn't want to do it without a partner, and I didn't want to do it with someone who didn't want to do it. So that clock just went on ticking by. So I had to circle back of what was the value of that, and then I'll let you take it from there. Like, what else could I do that fits in that value?
Yeah, no, exactly. Yeah. And thank you for helping to pause and clarify that distinction, because it is a difficult one for many of us, I think, to make.
Yeah.
And especially when, like I said, the goal is very clear and specific.
Yeah.
And I use that because it's also the focus on the goal is what is taking people out of their lives and in some ways contributing to the distress.
Yes. 100%. Right? Yeah.
And so especially right now in the middle of COVID, it is a good time to circle back to what's your true north? What are those values? Yeah. What is about this? And what are things that you can do? What are actions and steps and behaviors you can take now that are reflective of those values?
Exactly. So yeah. What are some things that that you've seen people pivot to that might be reflective?
Yeah, and I will, I can share some stories that maybe kind of pull in a different
like integration. Yeah.
Lives,
so
right?
Disclaimer, any stories you hear, unless they're about us, are an integration of many people and don't represent any particular client. Put that in a little banner on the bottom.
Yeah. Because one thing that I hear sort of very common in my office is people kind of have put their life on pause, right? Because they're focused on like the outcome.
Of course.
So it's like, we're not going to look for a new house. We're not going to buy a car. I'm not going to change jobs. And I think one thing that I have seen recently is that kind of shift, and like working with a client who was, in a job for a long time, even though wasn't happy with the job, but felt like the job, sort of the schedule of the job and the parameters of the job and the demands of the job was well suited for parenting and would be the ideal job to have.
Oh, interesting.
Once the first became a parent, yet miserable. Like it's a hostile work environment that they're very unhappy in.
Interesting. Yeah.
And now like saying like, maybe if there are job opportunities, especially right now in this environment, that present themselves that are better aligned with how I want to show up in the world. Again, back to those values, the kind of what I want my work to represent, what I want my work life to be like, and able then to connect like exactly, because guess what? When that happens for you, that actually creates the kind of environment that you want to be the best parent that you can be.
Right, because you're more happy and contented, I'll say.
Exactly.
I'm very hopeful, and I think a lot of our colleagues are saying similar things, and I'm hearing non-psychologists, lay people saying the same thing, that this is a time where certainly we have to have food on the table and a roof over our heads. And if we're on that Maslowian hierarchy, right, where we've got safety and security and belonging, that we can actually take a moment to reflect on how was all that busy stuff distracting me in a way from what truly matters to me. How can I start focusing on what I call big rocks instead of busy rocks that can become reinforcing because there's small tasks that can get done. You can check a box and you've been reinforced, but they're like any addiction. They distract you from what's really going on. So hopefully in family planning, right, we can use this time to really focus on what is the value that is guiding that, and how can I start to build maybe more time around the house or whatever.
Exactly. And that's where the value works becomes really crucial and critical. It's hard for people to see it at first. But it's like, yes, you are creating, like you said, the environment and the life that you want and the way you want to show up as a parent when you focus on those values and not just the goal.
Yeah, so I have and I'll put it up in the notes afterwards. I have a little video audio exercise in the written book and in the new audiobook. But all the videos from the first book are free on my website, and I'll put the link to that. So in that guided exercise, it's a values exercise. I have people visualizing, yes, the goals and outcomes, but it's really in an attempt to start creating an exposure exercise to what you are coming up against when you visualize that. So we could visualize, what we want our family life to look like. So once you have clients identify that value, so those who are listening, once you know what the value of having a child or any other goal that got truncated because of COVID, what the value is, once you visualize that and you visualize what it would look like moving forward, when you do that in a kind of a meditative way, you'll very quickly notice all kinds of stuff shows up like, oh, that'll never happen. I can't happen. It's going to be too much work. And when you practice continuing to visualize it anyway, it's a little bit like sports psychology, right? Where the sports psychologist has the golfing, the golf pro visualizes putt over and over again. When we visualize success like that, visualize our values like that, it's exposure therapy, and it helps us notice what's getting in the way from inside us. Do you have any kinds of values exercises or values take-home work that you have clients work on, or ways that they can start to articulate this new way of looking at fertility in a way?
Yeah, I usually go back to the old school, like think about your birthday, your 75th birthday, and what you want that to be about. And what
it's old school for us. It's not
necessarily for us, right? Yeah, everybody else, right? Sort of my go-to default exercise, and
what do people tend to say when they say?
And why I find that helpful with the infertility? Well, you tell people what it is, and so what you do is you envision yourself at your 75th birthday. There's also another one where you envision yourself at your funeral, but I like the birthday party.
I think it's a little more optimistic.
Exercise a little bit better, where you envision yourself, in the future, and you think about everything. You think about the setting, the environment. What kind of party is it? How many people are there? Like what's the celebration like? And then you think about who is there and what are they saying about you at this party, and then sort of look for themes and that emerge from that activity, and then come up with that like nuggets, right? Yeah. And this is actually very helpful, I find, with the family planning process, because very often people say, I see my kids, I see my grandkids, and I say, well, what are they saying about you? What is the meaning of their presence at your birthday party? And that's where we can sort of get at that like understanding of what that means. And
who you want to be, right? How you want to walk through this process, how you want to walk through fertility, how you want to walk through COVID. How do you want to reflect? I often think about Tati, right? Ruben's mom.
Is. I know who Tati is.
Yes, exactly. I mention her a lot because Tati is Ruben, my husband's mom, who is a Holocaust survivor, a child abuse survivor, a Castro survivor, has, I think 26 grandchildren now. She's 94. She's still completely independent. And she walked through all that. We can walk through this. And these values exercises and those visualizations are, how do you, when you hear other people saying these things about you, when they're toasting you at that 75th birthday, it gives you a hint of how you want to show up with your hands, feet, and voice every day. Now, do you come across what I've come across a lot when I'm doing that exercise is sometimes people will say, well, they'll become tearful, right? And they'll say, I'm nothing like that right now. Or they'll stop and they'll say, wait, do I visualize what I want them to say or what they'd actually say?
Right.
And that's where the ouch and the good work shows up. So to find that disparity between who you are and who you can be.
Yeah. No, I definitely get that. And also the like who I thought I wanted to be, or because I think like going through any kind of medical challenge or physical challenge or emotional challenge kind of pushes a person to reconsider, like, I thought I was going to navigate the world this way, but there's actually this part of me too that's showing up. So it creates an opportunity to kind of honor and acknowledge all of us, again, trying to avoid gender stereotypes, but like women that show up in my office who are like, I'm not used to questioning authority. If the doctor said this, it must be that. And being frustrated at not being, I'm like, well, then maybe there's a part of you that did get angry, that doesn't like this doctor. And that's okay. Like,
absolutely. Embrace that anger.
Let's own that. Yeah.
And the non-judgment piece, right? So a lot of judgment can creep up when you're like, wait, I feel like I should show up as this sort of perfect angel who just walks through with grace and everything, and starting to get familiar and empowered, because anger, I like to remind everyone that every emotion has a message. And the message of anger is something ain't fair here.
Exactly.
Something's not fair. Someone's not doing enough or taking too much. There's a boundary. And a lot of times we have to listen to that, because that's when we're not good at asserting ourselves. Side note, this week's Skill Weekly is about just this. So check it out on mindfulmastery.com.
Very good.
That was not premeditated, just happened to fidget. Yeah. So learning those skills of assertiveness, it all ties back to being your own advocate in any medical situation. So, so true.
Yeah. Yeah.
So if we had some watchers or, viewers who are either somewhere stuck, got interrupted in their process or in any process, really, is there a way that they can, so I have my video, is there any kind of an exercise that they can do on their own, or just to encourage them to sort of visualize that sort of 75th birthday on their own?
That's what I think I would go to that one, sort of visualizing your birthday. There's another metaphor that I sometimes use, and there's a video clip online about values versus goals. I think it's Russ Harris. Who's,
he does great ones. Russ Harris. Guys.
Yeah, and it's a clip of cartoons, so it's not like live people, of two kids on their way to an amusement park, and one kid is focused on the goal, and so he's like, when are we going to get there, when are we going to get there, when are we going to get there, and the other child is focused on his values of curiosity and adventure and fun.
Sweet.
And so the kid who is on the goal is just like, it's like, when are we going to get there, when are we going to get there, but the other kid focused on values is like noticing the trees passing by, noticing the cars, playing I Spy with their parents, so they're actually in relishing and enjoying in the moment. They're in the moment, and in one outcome, they arrive at the amusement park and they both go about their day and they have fun. But in another scenario, the car breaks down on the way to the amusement park, and so the outcome is gonna be the same, whatever it is. And we don't know what the outcome is, but having those values helps us think about how we want to navigate the journey. And again, who we want to be. And so, and I think, and I use that specifically around infertility, but I think especially right now with COVID for anyone, that is an opportunity to think about how we want to show up, with our family members, with our friends, and what kind of work we want to do. Because, we don't know the outcome. We don't know when this is going to be over, but we can make a choice about, how we are each day along the way. And that would be rooted on having a sense of, again, those values, who we are, how we want to show up in the world. Yeah.
And first of all, I love that. Thank you, Russ Harris. I'm going to go dig that one out. And
it's a great one.
I was right there with you. I was like, I think I was living in my values. And for people who need more concrete steps, you can still make, like, so if you're more sort of like list task manager like I am, like, you could still make lists of other things that are in your control, right? Your self-care, right, of your vehicle for if you do get to re-engage in your fertility treatments. You can I encourage people to make some little checklists, but even on like a microscopic level. So a big mistake we make with goal setting is that we set one big long-term goal as an outcome. Right? And outcomes are generally not in our control. It's the tasks and steps that lead up to that are in our control. So I ask people to set goals in 3 levels of personally things you can do, never an outcome. Like I want to get pregnant is an outcome that really isn't, you can say I'm going to have more sex, or you can say, I'm
going to eat more healthy.
Exactly. So writing down those small things that are in your control, and then setting small goals. So in levels. So if you just say I'm going to exercise 3 times a week, then the minute you don't, you've failed. So better to set an optimal, like if I'm a rock star, I'm going to exercise 5 times a week. If I'm doing pretty well, I'm going to exercise 3 times a week, and I still did darn good, and I get a pass if I exercise at least once. So optimal, acceptable, and pass in your goal setting related to your values and things that are in your control. And we'll then you can start to reflect on, I will be proud of myself of how I walked through this period. How about meditations? Are there fertility meditations or anything like that available out there? Have you seen anything about that?
There are. And I have most of them on my computer. I'm like,
sorry, surprise attack on that one. I did not prepare for that question.
Yes. And the ones that I've seen are specifically around like again, back to that idea of a time frame around the cycle and where you are in your cycle, and what this particular phase of treatment is requiring. But there's some that's about finding stillness and being in a still space. Again, for anyone who's very familiar with this process, there's something called the 2-week wait, which is when you are from the point of possible conception to when you can get your first pregnancy test completed.
Right.
Now with advances in technology, it's more like 9 days, but we still call it the 2-week wait. And it's a like gut wrenching experience for people because you cannot, and so it's like we're now in an extended 2-week wait for some folks, right? And so yes, the meditations about silence, finding stillness,
noticing urges.
Yes, exactly. Noticing, honoring those urges, those feelings that come up, and without judgment. I love the second level of the steps that you gave with the optimal, acceptable path. Yeah, because that's something I share with my clients quite a bit as well. Is like a part of that sort of tuning in and being present in the moment is attuning to what you need in that moment. And if in that moment you recognize that you just need to sit and cry, allow yourself to sit and cry. If in that moment you just, because sometimes the stress of not doing something is more harmful than like the thing that you would do.
Yeah, the almighty shoulding. I should be doing this. I should be doing this. Right now it would have been my appointment time and back
so I'm
to
just
center.
don't judge, attune to what you are emotionally, physically needing. Know what that is, right? Like pay attention to it. So it can still be aligned with your values, but also not judging or criticizing yourself either.
I've been thinking, and I think I wrote a little bit about that in this week's blog about this, knowing what you need, right? So when we're busy, right? The tasks are thrown in front of us, the deadlines are set, everything's right there. But when you come to a place of pause where we are now, this is the time to say, what do I need? What do I really want? And guess where you learn that? From your emotions. And when we're really good at muting and shutting down our emotions, then we start to like get that kind of anhedonia, like so this is a great time to do the painful and super growth promoting work of asking yourself what you need. What would a child or having a baby? What would that serve for you and your needs and your ecosystem and your support system? So that brings me to an important question to maybe wrap up on. We'll see where we go. How about transitioning from deciding, window came and went. My doctors are saying, honey, give up the goose in not so kind ways. And then making decisions about alternatives, right? To adopt or foster or others. Any observations in your expertise or thoughts about that?
Yeah, and I hate to sound like a broken record, but it kind of builds upon the value system, right, that you have in place, and helping people kind of circle back to that. And many times this is where the crux of the conversation is for some clients, because they are trying to decide what is the next course of treatment, what's the next step to take, should I proceed or not proceed, and that's like you said, sort of looking at that and checking the emotions. Like, so what is, if you have this conversation about possibly adopting, what shows up for you? What do you notice? Right. And being willing to kind of experience that and make a decision, again, a non-judgmental decision of whether you will or you won't, but having the clarity of it. And one thing I always say to clients is, we use the values as a guide because they give us clarity. It doesn't mean it'll be an easier decision. Yeah. It will just be there'll be more clarity to your decision.
Good point. Yeah.
So it's like, so what was it about having a family, and are there other ways to create that? Like either through, extended family, other friends, other community networks. What is it about family? Is it nurturance? Is it, so are there ways to nurture people in your life, or other people in your life, or other things in your life? So making that transition comes back to like, what was this about? What did it start for you? And how do you get that need met for yourself in a healthy way?
Yeah, yeah, so many thoughts flew through my mind from my own experience of, passing through the fertility window to wondering if it could bring up when you were first telling that story, for some reason it just popped in my mind, or just the question, has anyone noticed that they tapped into some anger, like something was being taken away from them, some like right. And maybe some people might discover something about like what is that need or right that needs to be met in some maybe even very different way. For me, I really went back and forth, like, if I'm saying that family is a value for me, and yet I was not willing to make the leap of having a child alone, like I really had to do some very deep soul searching and figuring out, like, why didn't I adopt? Why didn't I do a lot of things? So it's soul wrenching and potentially really expanding time. That might be a nice reframe also of this challenge, whether it's infertility or COVID disturbance in some other way in your life. Finding the meaning, as many great psychologists have said in the past, when you find the meaning, then you find the truth for you of how to walk through it. All right. Well, you know what? I think this has been an awesome conversation, and this is a good place to ask you, where can people find you?
Oh, sure. Thank you. You can find me on my website, tonyawood.com, TONYAWOOD.com, and it has any information to get in touch with me.
What's your Facebook page?
It is it's Tonya Wood, Ph.D.
No, I think it's at Dr. Tonya Wood. At Dr. Tonya Wood, on all one word.
One thing I'm doing during COVID is getting better at my social media. So.
Yes, exactly. And we're helping her right here. So if you know anyone, if you're having fertility challenges and you need a champion, Dr. Wood is your woman. Tonya is available for telehealth services during her very busy schedule of trying to run California Psychological Association and everything else. Thank you, everyone. If you have any follow-up questions, as always, please don't hesitate to reach out, and I will forward to Dr. Wood your questions, and you'll find this video up on YouTube on my YouTube channel. All right. Thanks, everyone. Until next time, may you be well.